All right. Hi, everybody. Thanks for coming tonight. Welcome to today's Green Living Seminar presentation. I'm Elena Traister, Professor of Environmental Studies here at MCLA. So this semester's Green Living Seminar is organized around the theme, Greening the City. All of these presentations are free and open to the public. They take place here in room 121 of the Feigenbaum Center for Science and Innovation on the MCLA campus. If you would like to look at the schedule of upcoming presentations or get the link to recordings of prior presentations, you can go to mcla.edu/greenliving, one word. As usual, our presentation today will last for about 45 minutes, and then we'll have a chance for some Q&A at the end. And before turning it over to tonight's presenter, just a quick announcement for next week's presentation. On Wednesday, March 30th, we'll hear from Dr. Hank Art, Rosenberg Professor of Environmental Studies and Biology Emeritus and Board Chair of the Mohawk Trail Woodlands Partnership. He'll be presenting a talk titled The Mohawk Trail Woodlands Partnership, Sustainable Forest Management and Natural Resource-Based Economic Development in Northwestern Massachusetts. Today's presentation, titled Public Health and Community-Based Participatory Research in Urban Environmental Justice Communities, will be given by Dr. Madeline Scammell, Associate Professor of Environmental Health at Boston University School of Public Health. Thanks so much for coming.
Thank you, Elena, and thank you all for inviting me to speak. It's really great to be here. The title of my talk, as Elena said, is Public Health and Community-Based Participatory Research in Urban Environmental Justice Communities. And oh my gosh, what a mouthful. That is a lot of words. And so I plan to talk about each of those words and make sure that we all understand the key phrases. But first, by way of introduction, here we go. I wanted to start by way of introduction, just placing us here in Massachusetts. And I come from probably the furthest point from here, originally on Cape Cod. I now live in the city of Chelsea, Massachusetts, and we are here. So for whatever that's worth, I love Massachusetts. It is home. It has always been home, yes. And I will revisit this map and explain the colors a little later in the talk. How many of you are from Massachusetts? All right, great. It's hard for me to give a talk without being interactive with all of you, and apologies to the folks who are watching. But I want to start with the phrase public health, and what does public health mean? I like this definition. Public health promotes and protects the health of people and communities where they live, work, learn, and play. So where we go to school, the buildings we spend our time in, the parks, where we work, those are all aspects of public health. And I like this sentence from the Introduction to Public Health. Medicine focuses on healing patients, individuals who are ill. Public health focuses on preventing illness, and I'll add in communities, in populations. And the figure also shows some of the things that contribute to public health: science, technology, nature, decisions like recycling, and policies. So people tend not to think of public health when they're well. It's kind of one of those things that operates in the background. If it's protecting us, then that's great. But when we fall ill, that's when we start asking questions like, why? What are the structures and settings that have contributed to my illness? And no time in my life has that been more true than the last 2 years with this pandemic. People have started talking about public health. Applications to the BU School of Public Health had hit records. Everybody is talking about epidemiology, which is a set of tools, an approach to studying public health problems. I'll talk a little bit about that. But policies are a really important part of public health as well. And like the policy that we're all wearing masks right now in this room is one example. Another example, is a policy in 1977 that the EPA banned the discharge of PCBs directly into the nation's waters. So PCBs is the chemical that I'm going to use as the prop for telling you a story about community-based participatory research and environmental justice. PCBs are considered a legacy contaminant. They're part of our legacy, and they have defined many of our futures. So here in this news article, it states, the EPA noted in announcing the ban late yesterday the past widespread use of the chemicals in the production of lubricant additives, hydraulic and compressor fluid, carbonless copy paper, plasticizers. PCBs are a plasticizer, paints, and other products has resulted in PCBs present throughout the environment. And although they have been substantially curtailed, this is 1977, PCBs which have entered the environment cannot, in most cases, be recovered, and they will require many years to degrade. The public will be alerted to the potential hazards by careful long-term monitoring of PCBs in food. So we're going to come back to this PCBs in food because it's kind of important for this story. But also, if my dad had read this article in 1977, would he ever have imagined that I would be one of those people monitoring PCBs, but not in food? 45 years later. So what are PCBs? They're very stable chemical compounds. They're characterized by these two rings that are called benzene rings or biphenyls. Polychlorinated biphenyls are their full name. They're polychlorinated, meaning they have a lot of chlorines attached to those carbon structure, those rings. And the type of PCB is dependent largely on how many chlorines are attached and where. But so these are man-made. They're not naturally occurring, and they were widely used, and they are bad for human and animal health. They probably cause cancer in people. They definitely cause cancer in animals, and they definitely cause non-cancer effects on the immune, reproductive, nervous, and endocrine systems. So that's almost every system that our body relies on to function properly is adversely affected by PCBs. So this is one of the water bodies that PCBs were regularly discharged into prior to 1977 when the EPA banned the discharge. But this is New Bedford Harbor. It is, well, I'll show you some, here we go. That's New Bedford in Massachusetts, south of Boston. Here's a close-up of the harbor. It's bordered by several towns, including New Bedford and Fairhaven. And this is the article that you were assigned, and I commend you all for reading this article. It is probably one of the hardest articles I've written, so if it was hard for you to understand, I would appreciate that. And if it was not so hard for you to understand, I'd say that's a major accomplishment of my co-authors for making a complex topic really difficult. I mean, really easy to understand. But I'm happy with the title of this article because it tells you the major finding, which is that human health risks due to airborne PCBs were highest in New Bedford Harbor communities closest to the harbor. So airborne is key here. It's not through food. And so now I'm going to tell you the story, but the background is that New Bedford Harbor Superfund site is 18,000 acres. The whole harbor itself, an area, is 18,000 acres. And two companies that manufactured electronic capacitors disposed of their PCB-containing waste directly through outfall pipes and through the sewers into the harbor from the 40s to the 70s. In addition, the harbor is contaminated by heavy metals, and it was designated a Superfund site, meaning a federally managed site that poses imminent risk to humans and the environment, and slated for cleanup. And just over 100,000 people live within 3 miles of that site. So in 1990, 7 years after declaration as a federally managed site, EPA announced plans to clean up the PCBs and the contaminated sediment. So if you can imagine, the water is contaminated, but the ground of the floor of the harbor is contaminated and all the sediment around it. So they proposed on site, like building an incinerator at the site in New Bedford, and that was opposed by the public. So then they'd landed on dredging, digging up a lot of the contaminated sediment from the floor and taking it off-site, out of state. But still, there are thousands of tons of contaminated sediment. So still today, they're mitigating that harbor. And residents have been concerned. And honestly, a lot of what has happened is because residents have organized. But what you hear about most often when it comes to PCBs is the consumption of seafood that would be contaminated, and that would be the primary pathway by which humans would ingest PCBs. So if you walk along the harbor and any site that you can access the harbor, you will likely see signs like this that warn you against fishing or eating any of the fish consumed in the harbor. But residents who live, work, learn, and play immediately adjacent to the harbor asked this question: are PCBs in the air that we are breathing? Are PCBs from the harbor getting into the air? And for a long time, they got no answer to that question, except no, you're fine. The primary exposure route is through the consumption of food. So, Toxics Action Center, which is actually now Community Action Works, is an organization in Massachusetts that has offices actually throughout New England, and they exist to help communities organize when they're confronting environmental exposures. They're primarily organizers, but they also have scientific and technical experts that work with them when is necessary. Alternatives for Community and Environment, ACE, is also a similar organization, but they specialize in providing pro bono legal expertise for community groups. So they partnered along with myself and my colleagues at the BU School of Public Health through something that we had called a Superfund research program. It was a federally funded program to work with communities who are affected by the wastes at Superfund sites. But we didn't have the expertise to answer the question that they had. Is it in the air? We just don't have the capacity in our laboratories. None of us studied PCBs on a daily basis, but we partnered with the University of Iowa, who has a program that focuses solely on PCBs, people whose generations of experts, and I mean generations, like people have died since the program started, studying PCBs. And then we worked primarily with Karen Valandry and the members of her organization, Hands Across the River Coalition, who asked the question in the first place and really made the connections with ACE and Community Action Works, who then contacted us. So we worked with all of the members, and I don't have photos of the members to respect their identity. They would rather not be known. They've received a lot of negative publicity for being vocal opponents to many of the cleanup strategies in the harbor and the industries along the harbor as well. So no photos of them, but to try and give you a sense, we worked with them to identify on a map where people live, where members live, at various distances to the harbor who would be willing to host air monitors in their yards so we could monitor PCBs in the air where they lived. And this is what the map looks like. Our monitors are the ones in red, and the yellow and the blue monitors are EPA monitors. We use very different technology, and we were able to say more about the PCBs because we sent them to a laboratory. And we used graphics that were created by a graduate student, Mei Wu, to illustrate the differences between our monitors and their monitors. And ours were essentially 2 salad bowls with a foam filter in between that passively attracted PCBs, all air that just flowed through the salad bowls. The PCBs would get caught on the filter, and then the filter would be sent to the lab after a certain amount of time, and we would get a read of all of the PCBs on that filter. EPA's monitor is active. It sucks the air up, and the laboratory doesn't do quite the same analyses. So we had all this data, and we used something called Statistics for Action, workshops that this group of statisticians and scientists and community organizers collaborated on to teach people when you have soil data on concentrations of contaminants, when you have drinking water data and you're trying to understand what it means for your health, if you have air quality data and you don't know how to interpret it, these workshops are meant to help you with that. So we shared the data with our study participants in a workshop called A First Look at Data. And this is literally what our data looked like. There are 209 different versions of PCBs, and then we had all the different sites where the monitors were located. And I have to tell you, I'll be honest, I was like, really? We're gonna just share the raw data with everybody? Like, this is kind of scary for me to look at. And, but really the folks at Community Action Works said, yeah, we definitely should do this. We're gonna do this. And so we printed out these big pieces of paper, and folks in the room had similar reactions as I did, but they sat in pairs and they really poured through. They started writing their observations down on sticky notes and questions that they had. And by the end, we had a lot of really good questions as well as observations about some places, some monitors that appeared to have lower levels than others, and some congeners of PCBs that appeared to differ depending on the location. So we met several times over several months to understand these data together, and graduate students ran plots and did analyses in response to their questions. And then we shared everybody's individual monitor results with them in comparison to all of the other monitors, as well as in comparison to guidelines meant to protect health from inhaled PCBs. So this is the non-cancer risk guideline, and this is the cancer risk guideline. But so as you can see, generally everybody's monitor was well below those established guidelines for protecting health. And we shared this in a number of different ways, the same information in figures and in tables. And we got a lot of great feedback from the participants on what was an effective way to communicate this information to them. And then we did the bigger analysis, which was not just documenting that there was the concentrations of PCBs in the air, but estimating the human health risk, which is the paper that you read. And what we found is that there was indeed health risk based on prior studies examining health of animal models and humans. And you can see, that concentrations were highest closest to the harbor and really fell off about 300 meters from the harbor. And it was a really nice curve. And then you can see that the risk posed by those although it looks low, that means that the risk is high, likely to result in adverse effects on the thyroid. So that was alarming, actually, for many of the residents who live, work, and play, spend time along the harbor, that it's possible. The data indicate, based on all prior studies, that there's a chance that their thyroid hormones could be affected by breathing the air at the concentrations we measured. This is the website IRIS. This is what EPA uses to publish all regulations and their assessment of chemical toxicity. And what I've circled is that there is no guideline or standard for inhalation of PCBs. They have not assessed that. They've assessed cancer risk, but they've assessed ingestion of PCBs, but they haven't set a standard for the risk to humans of inhalation. So this is something EPA really needs to do. Our study is contributing to the evidence behind such a policy, and I'll show you a photo in a minute that we did share it with EPA. We've been in contact with EPA the whole time. But these are just a few of the publications. Really what was most exciting for some of us was that we spent so much time and effort trying to figure out how to effectively communicate these findings with the residents. And it was hard, really hard. We also, Komal Basra wrote an article about the loopholes in regulations for cleanups at PCB contaminated sites across the country. New Bedford Harbor is just one. And her conclusion, current practices may not adequately protect those living or working near these sites from airborne PCB exposures. So we also created fact sheets, because who is most vulnerable to low thyroid function is actually the fetus while it's in a mother's stomach. These are fact sheets that were given to healthcare centers in the New Bedford Harbor area to try and raise awareness that if you are pregnant, really check your thyroid function, because living here could put you at greater risk of low thyroid function. And tried to get the message out through a number of different ways, including using QR codes. And unfortunately, the pandemic happened just as this work was coming out, so we were pretty much cut short. This is a photo of us outside the office of EPA's office in downtown Boston after we had just shared the results with them in a meeting. And I just want to point out this person here, Katie Tomshow. She was an undergraduate with my friend Riley Howard in the back, who was the chair of environmental studies at Dickinson College while I was working at the School of Public Health. She applied to BU after Dickinson because of her experience working with Riley. And now she's at Harvard School of Public Health getting her doctorate, but she's still working on this building the skill of reporting results back to community members who are participants in studies and often just don't get the information in a way that's clearly accessible to them. So I'm just gonna skip over these. Also, for larger studies, we had 19 people in our studies, so it was a lot easier to spend all this time with them. But if you have a cohort of hundreds or thousands, getting them their individual results in a meaningful way with figures and tables is a huge challenge, and most people just don't take the time to do it. But these two colleagues of mine that I work with, Aaron Polka and Chad Milando, developed a software, a program actually in the software Are that's freely available online, so that people who have results of studies can create individually tailored results for each individual study participant to be mailed to them or given to them in some way. And using what we refer to as characteristics of good environmental literacy and communication. Okay, so going back to PCBs. New Bedford Harbor, as I alluded to, is not the only place in the country that has major PCB contamination. In fact, Riley, prior to graduate school, worked on PCBs in the, what's the river? The Hudson River, thank you. The Hudson River. So in 1977, EPA banned discharge into water bodies like the Hudson River, like New Bedford Harbor. But then in 1979, they just banned manufacture of PCBs altogether in the United States, as well as numerous uses. So that was 1979. Does anybody know what this photograph represents? I know Riley does, so you're off the hook. Okay, this is people laying their bodies across the road while truckloads of contaminated sediment are being delivered to a small town, Afton, North Carolina, in Warren County, in 1982. So after EPA banned the discharge of waste into waters and the manufacture of it and various uses, industries that had invested a lot of money in PCBs and had a lot of PCBs didn't want to pay a lot of money to get rid of them. And so one thing one company did was spray PCB containing oil along 210 miles of roadway in North Carolina in 1980. So it was 30,000 gallons of PCB containing oil across 14 counties. So that roadside became itself a Superfund site that had to be dredged, resulting in 6,000 tons of excavated soil that was highly hazardous. So of course, they identified a community that was 84% African American, a very high poverty rate, and that would be the site for a brand new landfill to bring all of this waste. So when the first 6,000 truckloads arrived in 1982, that's what happened. And I'll show you more photos. People came from all over the country. This was really like a culminating event for people who felt that their communities were always dumped on, but this was a mega dump, and it was unacceptable. 500 arrests were made. People, not just arrests, I mean, people were placed in jail, 500 people. And the landfill went ahead anyway. It's still there to this day. But the Congressional Black Caucus of the US Congress requested a study by the General Accounting Office asking about the siting of hazardous waste landfills in this region of EPA, the Southeast region. And it was very clear from the results of this study that the landfills were located in low-income, primarily Black communities. Not long after that, that was 1983, the United Church of Christ Commission on Racial Justice did a similar analysis of hazardous waste landfills across the country and the characteristics of the surrounding communities, finding a very similar pattern. And this study was widely viewed as conclusively documenting that there's a disproportionate burden of hazardous waste in low-income communities of color throughout the United States. I'm sorry to say that they've repeated this study 30 years later with more sophisticated geographic mapping and statistical analyses, and found that the same pattern persists. So in 1991, there was a leadership summit of people of color on the steps of the Capitol in Washington, D.C., calling for environmental justice. And I'll give you a moment to read the slide yourself. It was a really great moment of real organizing and coordination among multiple different groups representing different historically disenfranchised populations in this country: Native American, Blacks, Latinos, and they came up with these principles of environmental justice, and I'll share them with you. But I just want to, again, point out the language referring to genocide and 500 years of colonization and oppression. We hear a lot of language like that these days, much more so than when I was in college. This language in 1991 was really, really unusual, and it made you stop, and I hope it always will. So the principles of environmental justice, there are 17. I'm just sharing with you a few that are very directly related to human health, to public health, and policy. A fundamental right to political, economic, cultural, and environmental self-determination of all peoples. The cessation of the production of all toxins, hazardous waste, and radioactive materials, and that all past and current producers be held strictly accountable for to the people for detoxification and the containment at the point of production. The containment at the point of production is really important. People talk a lot more now about regulating products from cradle to grave, so that the producer is accountable to the whole life of the product, even if after it's consumed or bought by a consumer. And then environmental justice demands the right to participate as equal partners at every level of decision-making, including needs assessment, planning, implementation, enforcement, and evaluation. So that was 1991. 3 years later, President Clinton signed an executive order known as the Environmental Justice Executive Order. And it talks specifically about human health research and analysis, again, requiring that the most vulnerable, the people who are most impacted by environmental hazards in the workplace, for example, be included in research that addresses these hazards. So this is where we come into community-based participatory research. But first, a definition of environmental justice, because you've seen some of the principles, you know more or less the origin of the concept, but this is EPA's definition of environmental justice: the fair and meaningful involvement of all peoples, regardless of race, color, national origin, or income. You can keep reading. Equal access to decision-making process to have a healthy environment, again, in which to learn, live, and work. So there are various types of justice, and I just want to highlight, this is very oriented toward procedural justice. This is not punitive justice. This is not corrective justice. This is saying, to have environmental justice, we need to engage the most impacted. And that's really good. It doesn't go all the way in terms of the principles that were articulated at the People of Color Summit, but this is EPA, and this is what we're going to do going forward. The National Institute of Environmental Health Sciences, which funds a lot of research on environmental justice, funded partnerships of community and academics to do research with communities, many of them urban. This special issue of the journal, our Fields Journal, is edited by Peggy Shepard and her colleagues at West Harlem Environmental Action, who were really at the forefront of the environmental justice movement. And the title is Advancing Environmental Justice Through Community-Based Participatory Research. So here we've done public health, now you know environmental justice, and here we're getting to community-based participatory research. And I'm not going to give you a definition of that, but I will show you an image. because I think what I really always hope people will remember is that CBPR, as it's known, community-based participatory research, there's no recipe. It's not a method. You can't just like do it or not do it. It's really a mindset. It's an approach, and there are lots of techniques. But ideally, research that's CBPR is in the middle of partnership between community groups and academics, meaning you share decision-making power, you share authority and ownership of the data, you share in the benefits and the risks. That's a true partnership. Most research is not partnership between the people who are most affected by the outcome and the people trained with expertise in how to study a problem. Most of the time you have professionally driven and controlled research with very little community involvement. And some of the time you have really community-driven and controlled research where scientifically or professionally trained experts are consultants and advisors to a project. But I always tell my students, think about where on the spectrum you would like to be in your life and be intentional about it. And when you develop relationships with community partners as a public health professional, also think about how you want the relationship to be and what your assumptions are, if it's a partnership or if you're the expert, and all of the power dynamics that are always going to be there. So it's good to talk about them in the spirit of environmental justice. So bringing it back to Massachusetts, in 2001, a couple of sociologists at Northeastern University did this analysis of environmental hazards in communities in Massachusetts. So they looked at all of the hazardous waste sites, landfills, transfer stations, power plants, and polluting facilities, and waste incinerators. And then they looked at the demographics of the communities immediately in proximity to them, finding that environmentally hazardous sites are disproportionately located in working class towns and communities of color. So what the United Church of Christ found was true for hazardous waste sites across the country. This report identifies as a problem specifically in Massachusetts. And that was really informative for the following year. What would be passed, was an environmental justice policy in Massachusetts that identified environmental justice communities that would be at most at risk of not being part of the decision-making process or the participation when decisions of great weight were being made related to the environment. I will say, the prior slide that I just skipped over is Matthew Tejada, who runs the Office of Environmental Justice at US EPA. And he's got a great video that describes environmental justice. And they really don't talk about environmental justice communities. They talk about communities with environmental justice concerns. And that's important. I think in Massachusetts, we do talk about environmental justice communities. In fact, it's written into our policies and our legislation. He says, I'm going to go back again. We don't actually define EJ communities. We don't draw borders around certain places and don't label them. Right, okay, in Massachusetts, we do that. We do exactly that. But it's a real challenge, like to knowing what to do to best support communities with environmental justice concerns. Here in Massachusetts, we've identified environmental justice communities, again, by the demographics of the people who live there, household income, minority, foreign-born, or lacking English language proficiency, that those would be the reasons that contribute to people's not knowing that there are major policy decisions being made that would affect them. And so when there is such a decision being made in an environmental justice community, the government has the responsibility to do extra to provide translation, to hold meetings at times when people who work odd hours are able to be there, to have childcare, to publish the notice of the meetings in multiple languages. These are now responsibilities, according to this policy, of the state government. And I'll just say, I am going to wrap up soon, that during the pandemic, we saw the vulnerabilities to the pandemic, the greatest effects, almost very cleanly along the lines of what are considered environmental justice communities. We could have seen that coming, but we didn't. The Massachusetts Attorney General wrote a report using those data, identifying the unequal effect of COVID on communities of color in Massachusetts. And I want you to see the small print, I'm going to read it, remedying the legacy of environmental injustice and building climate resilience. Now we see a lot more connection between environmental injustices and climate, the unequal effects of climate change, again, on low income and communities of color, frontline communities. So, and I know one of your past speakers talked about this climate bill, the roadmap that passed in 2021, last year. It is a mandate for Massachusetts to essentially become carbon neutral by 2050. It also identifies environmental justice communities and increases the obligations of the state to those communities, especially as it relates to climate and reliance and impact of those communities by the fossil fuel industry. So just recently, there was an article in the Boston Globe saying, okay, so we had a year since the roadmap bill was signed to create an Environmental Justice Advisory Council, and that council has still not been appointed. So there are major questions about when is the governor going to appoint the council so that we can actually realize the mandate of this really incredible bill that was passed in last year. And that bill was passed because of a lot of organizing. And one of the things Matthew Tejada said from that video and in life is that EJ people who live in environmental justice communities, communities of color, low-income people, they should decide if they're an environmental justice community. And a lot of the people behind this bill are environmental justice leaders in Massachusetts who helped define what an EJ community should be. So here we are at the map that shows the environmental justice communities in Massachusetts. And you can see way up here, North Adams qualifies as an environmental justice community. Almost every census tract, it looks like, meets the income category, which is represented here by green. And I put the URL there so you can visit it yourself if you like. This is a map of the nation and all of the hazardous waste sites. So just bringing it back to the nation. You can also go there to look at what sites are in your backyard. I know that, and Riley has shared with me, that there's a lot of contamination in North Adams that's actively being discussed. And leave on a hopeful note. It seems ironic, but given the photo. But this debate between the presidential candidates of our last election was the first to mention the words environmental justice. I mean, these have been national concerns for disenfranchised communities for many years, decades. And President Joe Biden talked about environmental justice communities. And in his State of the Union, he also talked about the devastating effects of climate change and the need to promote environmental justice. So that is exciting. I think that we will have cleaner, greener communities in urban areas. Urban is the one thing I didn't talk about in the title. And I just want to leave you with this definition of health: a state of complete mental, physical, and social well-being, and not merely the absence of disease. And I believe that if we really want to achieve health and environmental sustainability, we must have environmental justice and human justice as well. So with that being said, I will thank you so much for listening to me talk nonstop for 45 minutes, and also thank my funders and my colleagues in particular with the nonprofit grassroots organizations who are doing the good work on the ground. And thank you all.